Hey guys, we're outside Pfizer's corporate offices here in New York City. Currently, where a host of groups are continuing their fight for equitable distribution of the COVID vaccines globally. As you can see, people are out here currently. And they're actually just getting everything set up and in the process of ready to go. So I know that, what is it? What is it that has the pharmacy inside of it? They're going to be opening up also for it. I forget what it is. It's one of the major chains, not... Could be Rite Aid, because I was going to get photos of the store. There was like an announcement on the news. But yeah, they needed to open up more accessibility for it.
No, it's in Boston.
No one is safe until everyone is safe. Free the vaccine. So if you're sharing out, go ahead and use that hashtag. Definitely there are a bunch of other hashtags, and follow on Twitter, you'll see I went ahead and used some of those because this fight's been going on not just here but also specifically in Europe, which I'll actually post up some stuff that have been tied in with over the next day or two.
We're going to get started in just a minute, but let's get the energy up. We're fighting. This is a long fight. We're fighting today, we're fighting tomorrow, so let's get the energy up. Let's start a little chant here before we get our speakers going. So I'm going to start our Free the Vaccine chant. I hope everyone can join me. Free the vaccine! 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 Free the vaccine!
The protest is to make it more accessible. Free the vaccine.
Here, we got members of the Center for Popular Democracy. Act Up is in the house. Got some Act Up fans. People's Action, Health Gap, Housing Works. Lots of people came together to put this rise and resist. Thank you very much.
Making it accessible. They're not protesting the vaccine, making it more accessible to more people, not just here in the U.S., but globally. Well, someone was asking, are they protesting the vaccine? Protest against the vaccine, and I just wanted to explain.
What's happening in this
Yeah.
country is a microcosm of what's happening all across the world, right?
Right.
Where the wealthiest people, the wealthiest communities, the wealthiest countries, entire countries, get access to this vaccine while everyone else is left behind.
That's right.
And so we're gathered here in New York, and there are comrades gathered in Philadelphia, in DC, I think Connecticut, all across this country, saying that that's not acceptable to us. No one should have to die from COVID when we have the means to stop it, and we do have the means to stop it, right?
Yeah.
Pfizer has the means to stop it. Moderna has the means to stop it. And so what we're asking you to do today is to share your intellectual property, share your technology, so the entire world can produce this vaccine. And we're asking our president, our new president, President Biden, to waive all the WTO protections that are preventing this from happening. And they're meeting today. And this is something we can do right now, and we're asking him to do that. And if we were to do that, we could meet this challenge with a commensurate, it's a hard word to pronounce, I don't know why I tried to say that, investment in healthcare, and we can make sure that we can actually end this crisis for all of us, right? Not just for some of us.
Yes,
That's
sir.
right.
Because if COVID has taught us anything, it's that none of us are safe until all of us are safe.
Yes.
All of us are safe.
And one last thing I'll say is that this is our vaccine, right? We paid for it already.
We paid for
We
it.
paid for the research, we paid for it with our money, and we're not going to pay for it with our lives. I'll tell you that right now. So I'm going to hand it off to our first speaker, Kamini Dubey, who is emergency medicine physician and a founder of the New York City Coalition to Dismantle Racism in the Healthcare System. I want to make sure I got that right. Thank you so much for being here.
All right, everybody, I'm going to say everybody in and you say nobody out. Ready? 1, 2, 3. Everybody in.
Nobody out.
Everybody in.
Nobody out.
Everybody in.
Nobody out.
At the peak of this pandemic, I was working as an emergency medicine doctor in the ICU. There we had a 28-year-old patient who was transferred into our hospital, a wealthy hospital. On the phone, he was uninsured. His father spoke to me, crying loudly on the phone, saying, "My son is not a criminal. My son has done nothing wrong. He has never drank. He doesn't smoke. He's a good person." Pleading to me to save his son's life. Testing? Testing? All right. We're going to try that again. So, at the peak of the pandemic, I was working as an emergency medicine provider in the ICU. There I met a young man who was on a ventilator. His father called me, tears in his eyes, crying loudly on the phone, "Please save my son, he is not a criminal." He was justifying his son's existence to me. Why we should save his life. Why? Because he was familiar with a health system that places profit over people. Where healthcare is not a human right, but it's a commodity. You see, here in the U.S., COVID-19 is acting upon a highly flawed, segregated system, a for-profit, multi-tiered health financing system that is rooted in racism, privilege, and profit, that places profit over people. You see, here we often talk about rationing of ventilators and ICU beds, but we have first rationed here by health insurance status. Where in this country, we've had a willingness to allow millions of people to go uninsured. Where hospitals turn people away, and you see, when hospitals turn people away based on their insurance status, they are placing their their dignity. They're placing their profit over these human lives. These egregious inequities are amplified on a global basis. With just 16% of the world's population, rich countries have purchased over 60% of available vaccines. I'm joining with all of you here today. We're joining with the world to plead with pharmaceutical companies, with Pfizer, with Moderna, with Johnson & Johnson, with the leaders of wealthy nations, our own President Biden, who made a promise. He should fulfill that promise to place vaccine equity as one of his top priorities. So think and act rationally and realistically, with social consciousness, with humanism, with compassion, and with common sense. No country can end the pandemic alone, not one. COVID-19 anywhere is a threat to public health everywhere. So while powerful countries and companies continue to secure vaccines like they've secured property and wealth, the biggest threat ever to ending this pandemic is uncontrolled, ongoing transmission in under-resourced nations. Despite the racist rhetoric of prior presidents and so-called leaders, we cannot wall off this nation. COVID-19 anywhere is COVID-19 everywhere. So pharmaceutical companies, Pfizer right here, stop placing profit over people. Ask yourselves, did you invest in the development of an effective vaccine to end suffering and restore health? Or did you do this to place your own profit over human beings falling ill? So do not go down in history as the perpetuators of catastrophic moral failure. Share intellectual property and guarantee open access to the know-how for COVID vaccine production all across the globe. This is not about charity and feeding the egos of leaders. This is about basic epidemiology and science. Now is the time to think beyond ourselves and to end this greatest cause of human suffering in recent times. So one more time, everybody in?
Nobody out!
Everybody in?
Nobody out!
Everybody in?
Nobody out!
Healthcare is a human right. Everybody deserves health. Everybody deserves a lack of suffering and pain, and we need to do all we can do now. Thank you so much.
So much. Next, we have a longtime HIV/AIDS activist, member of ACT UP. Got some ACT UP fans here. Founder of New Alternatives, Kate Barnhart.
Testing? Okay. More than 30 years ago, this country and the world faced another tremendous epidemic that took many lives. Did we learn anything? It doesn't look like it. Since then, healthcare in the U.S. has faced tremendous cuts and challenges. We've seen closure of hospitals here in New York. We've seen right now our own Governor Cuomo trying to cut the HIV/AIDS budget. If we should have learned anything from the AIDS epidemic, it's that putting profits ahead of people continues to kill and allows epidemics to spread globally. We need to stop doing that. We need to realize that no CEO needs $17 million a year in compensation. We need to realize that these drugs that these companies like Pfizer are selling do not cost that much to manufacture. It's all profit. They will tell you they need to make these profits for research, but a lot of the research is actually funded by our tax dollars. We paid to develop this vaccine. It's our tax dollars going to buy the vaccine. They are profiting off of COVID
They are profiting off of people's suffering and off of people's deaths. They need to let the patent go. They need to let companies make this vaccine available globally and to those in need here in the U.S. Pfizer should be ashamed of themselves. Shame! 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 We will not stop pressuring Pfizer. We're not going to go away. We're not going to be silent while people die. Pfizer, we will be back, and other pharmaceutical companies can expect the same. Act up! Fight back! Fight AIDS! Act up! Fight back! Fight AIDS! Act up! Fight back! Fight AIDS!
Thank you, Kate. Next, I'm going to bring up my friend Emily Sanderson from HealthGap. We're going to talk a bit and introduce our next group of speakers.
Everyone here? Okay, everyone can hear me? Yeah. All right. My name is Emily. I work at HealthGap. HealthGap's an international nonprofit. We focus on removing barriers to accessing medicines all over the world. A lot of what, like Kate talked about, a lot of what we're seeing with COVID-19 is the exact same playbook that we saw with HIV and AIDS. And so we're here to disrupt that cycle so that we don't have to wait 30 years for someone to get a COVID vaccine. Right now, people in low and middle income countries are looking at getting the vaccine in 2024. While the US is looking about when can I go back to my life as normal, right? We cannot wait for 2024. We need the vaccine for everyone as soon as possible. Because no one is safe until everyone is safe. All right, I am happy to welcome our next speaker, Bruna Ray. Bruna is a family physician in Queens and a board member at Physicians for National Health Program.
Hi everyone, can you hear me through the mask? Yes. Alright, my name is Bruna Ray. I am a family physician here in New York City. I've worked in New York City as a clinician, as a physician for 10 years, and I've worked from the northernmost part of the Bronx all the way to the southernmost part of Manhattan. And currently I work in Queens, New York, at Elmhurst Hospital. Elmhurst Hospital was considered by many the epicenter of the pandemic here in New York City. So last spring and summer I saw and heard from colleagues about thousands of patients coming in, hundreds of them dying. Like Dr. Dubé said, so many of them before, everyone before their time. It was a really tragic thing to experience. The people who I serve is Queens. I work at the city hospital, a public hospital. It is the patients there are mostly people of color and immigrants. All of them are on either uninsured or on public insurance, such as Medicare and Medicaid. Everyone in this country is underinsured, including my patients especially. I saw how COVID-19 disproportionately impacts these communities. Immigrants and people of color were disproportionately affected. That means that they got more COVID-19 than other people in this city and in this country. They got sicker and they died more frequently. And now we're seeing with the vaccine that the same communities that were worst affected by the disease are now getting access to the vaccine the least. In my 10 years of working here, I've seen how the American healthcare system is racist, is classist, gives disproportionate access to healthcare to those who are healthy and wealthy, and often whiter communities. And now we are here to say, as healthcare workers, that this kind of racism and inequality in healthcare, especially with COVID-19 and the COVID-19 vaccine, cannot continue in our name. Pfizer and pharmaceutical companies like Pfizer cannot make profits in our name at the expense of patients' health and lives. We we're here to say no. We're here to say that we must free the vaccine. We are asking that President Biden use his authority as representing millions of Americans and billions of humans around the country, around the planet, to say that Pfizer should not be able to dictate who makes vaccines, when they make it, where they make it, and who gets it.
Yes. Free the vaccine.
Free the vaccine.
Free the vaccine! Free the vaccine! Free the vaccine! Free the vaccine! Free the vaccine!
So Pfizer itself anticipates that in 2021, just this year, they will make $15 billion in profit on the COVID vaccine alone. Shame on them.
Hey.
So how do we free the vaccine? We free the vaccine by demanding that our president demands, as a representative of the public, that companies like Pfizer engage in mechanisms that already exist, that are on the books, things that have confusing, fancy terms like compulsory licensing and free licensing. These are mechanisms that already exist in many countries around the world that would allow pharmaceutical factories to make the vaccine in greater quantity than we have currently. As the last speaker said, if we go at the current pace, people will still be getting vaccinated in 2024, and that's not acceptable because the longer time that we have, the human population unvaccinated, the longer time there is, the more opportunity there is for variants to develop, as we've already seen, and that threatens the health of the entire population of the whole world. So it's not as though we can sit here and have our vaccine and feel safe and satisfied. No, as long as anyone is unvaccinated, all of us are unvaccinated. So I'm here to demand on behalf of my patients in Queens and our patients collectively around the world that we must free the vaccine. President Biden must tell Pfizer, Pharma, that they cannot continue the status quo, which is to decide who makes vaccines and for what profit. We must free the vaccine. So, ready? Everyone, fight, 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 fight. Healthcare is a human right.
Fight, 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 fight! Healthcare is a human right! Fight, 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 fight! Healthcare is a human right! Fight, 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 fight! Healthcare is a human right!
All right, thanks everyone.
Thank you again to Runa. Next up, I would like to introduce Brandon West. Brandon has spent his career fighting for everyday New Yorkers. As a voting rights activist, a union organizer, a racial justice advocate, a committed democratic socialist, and the former president of the New Kings Democrats, he's brought hundreds of people into local politics and built grassroots power so we can fight for things like healthcare for all. Brandon is running for city council in District 39. So, Brandon.
Thanks, Joe. So this is my name is Brandon West. I'm running for city council, District 39. And as I said, I'm a voting rights organizer. That's my career.
What do you
So what I do is I help build power for black and brown folks through our democracy. So what does that mean? People think that just means election day. It means Flint, Michigan. Flint, Michigan was a democracy issue. Major public health crises are democracy issues. If we're not bringing people into the system and we're excluding them, like beginning and end. So what does that mean right now? A lot of times I tell people, and sometimes people realize this, but in reality, inequality didn't get invented in 2020. Everything that we saw was sold by profit motives that exist throughout the history of this country. The inequality, the racial injustice in terms of access to care, baked into this country since it was created. So what we have to navigate now is 100% a reflection of needing to change what's been sowed by the racism that this country has been brought up upon. So I'm running in a district that has an overburdened hospital. It has a large aging community. It has an undocumented community in the southern part of the district. It has a lot of folks who are going to be impacted by this. Even though there is wealth, there's no way to hide. If we do not provide people the care that they deserve, we will all be impacted by this. And this is not, it is a national issue, it is an international issue, and it is a community issue.
Yes.
We have to be in our communities, making sure that the folks who are not brought into the process have every access to it. I know, I was just talking to a friend of mine, we were like nerds, we watch way too much news, neither of us informed as you can get, and neither of us understand exactly who's included in exactly access. If that's the impact for people who have way too much information, what do you think everyday people have access to? No one knows what's going on, and this is a reflection of our government, it's a reflection of the MarkApollo that our health system is based off of, and it's a reflection of really what we've allowed folks in power to be able to create. So what we have to do is we have to change the system, we have to call the power what it is, and we have to walk the walk and talk the talk, and bring our communities with us as we do that work. Is that something you want to do? Yeah. Okay, thank you so much.
Thank you. All right, I welcome up our last speaker for today. We have Marty coming. Marty is an activist, a community board member, a gig worker, and a drag artist running for New York City Council in Uptown Manhattan in District 7. Marty has been working in New York City for 13 years after moving to the city at age 17 to pursue a performing arts career. So Marty currently sits on the Community Board 9, serving the people of Upper Manhattan, and is an advisor on the NYC Nightlife Advisory Board. Please welcome Marty.
All right, thank you all for coming out today. We need to demand loudly, not just here in this moment, but every day until Pfizer and Moderna and the other pharmaceutical companies break their patent. We must break the patent and make this break the patent! Break the patent! We must break the patent! We must make this vaccine accessible to every single human being. How many times do we have to go through history and see human life devalued because people at the very top making the very most amount of money don't care about human life, they care about how many commas are in their bank account. Enough! 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 Our country is founded on the ideals of systemic racism that are still at play today, and it rolls out in our healthcare system. Millions of Americans don't have access to healthcare. Healthcare is a human right. Healthcare is a human right. Healthcare, the same as housing and education and access to food, are human rights. And we continue to have the people at the top push our marginalized communities down, and we can no longer allow this. And now we have vaccine apartheid happening across the world. We have countries that don't have the same economic value that we do, not having access, and no longer can we allow this to happen. Break the patent, make the vaccine accessible to all, and end this bigotry in healthcare now. We need the vaccine! We need the vaccine! We need the vaccine! We need the vaccine! We need the vaccine!
With this fantastic unchained vaccine right over here. So thank you everyone for coming. And we're going to move over this way. Move!
Stop! 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 Misleading! Misleading! The one that Ethiopia! Ethiopia! BBC! 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 Al Jazeera! Al Jazeera! Stop! 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 Misleading! 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 Ethiopia!
Yes, there is another protest that's going on regarding Ethiopia.
This is our place!
stuff that goes
You win
on.
all the time.
Yep.
Total international. So interesting. Well, let me see what they're.
Yeah, there's another protest related to Ethiopia. I'll post up some information on that. Like a lot of things, there are some people who've reached out to me regarding that on the international front, but...
Sorry, he just left. Sorry, there was a guy that was trying to...
Okay.
Sorry.
No, that's okay.
I'll point out, I'm just trying to...
No, it's...
It's a lot going on.
It is.
Can I get a shot of your sign?